Welcome back. In the chapter of health programs in India, in today's session we will discuss about reproductive and child health program. Under the RCH program, we have studied about the RCH phase 1 in a previous video. In this session, we will discuss about RCH phase 2. The reproductive and child health program has two phases. The RCH phase 2 began from 1st April 2005. The main focus of RCH phase 2 is to reduce maternal and child mortality and morbidity. We see reproductive and child health. Reproductive, maternal. You can remember like this. Child mortality. Maternal and child mortality and morbidities have to be reduced with a special emphasis on the rural healthcare. The major strategies under RCH are the essential obstetric care, emergency obstetric care, and strengthening the referral services. The essential obstetric care is by the institutional deliveries, allotting the skilled attendants at the delivery, taking the policy decisions. So, by the essential obstetric care includes the conduction of institutional delivery, and while conducting the delivery, the skilled attendants at the delivery, the health worker has to be skilled who is performing the delivery, and then the policy decisions. Under the emergency obstetric care, we have the operationalizing the first referral units. So when a case comes to the PhC's primary health center, and if it is a complicated case, we refer the case to the CHCs. So the first referral unit has to be under operation. So it should be working, it should have all the equipments and kits and the drugs and also the healthcare provider, skilled healthcare provider. And operationalizing the PhCs as well as the CHCs for round the clock delivery. Round the clock delivery is 24 hours delivery has to be provided. The 24 hours delivery service, which is nothing but round clock delivery. Also the third thing is strengthening the referral system. Again, the referral system has to be strengthened. So let us discuss in detail the essential obstetric care. Under the essential obstetric care, we saw the institutional delivery. The main objective is to promote the institutional delivery in this under the CHC phase 2. It envisaged that 50% of the PhCs and CHCs would be made operational as 24-hour delivery center. By the end of 2010, they promoted the institutional delivery, and they envisaged that 50% of PhCs and CHCs should be made operational as a 24-hour delivery center. Skilled attendants at the delivery. So it is now recognized globally that it has very successful in bringing down the maternal mortality by providing the skilled attendants at the delivery. So when a skilled attendance is performing the deliveries, then the maternal deaths can be reduced, and it has been observed around the globe. So the World Health Organization has emphasized that the skilled attendance has to be done at every birth, and they provided the skilled attendance at delivery. We see they provided the guidelines for conducting the normal delivery and also the management of the obstetric complications. The was educated or taught under the RCH phase 2. The guidelines were given for managing the obstetric complications and for conducting normal delivery. It was given to the medical officers, auxiliary nurse midwives, and lady health visitors. They were provided the guidelines for conducting the normal delivery and managing any complications therein. Then we have the policy decisions. The auxiliary nurse midwives, the LHVs, that is lady health visitor, and we have the essence, that is student nurses, they are permitted to use the drug in specific emergency situation. If an emergency situation arises, the student nurses are also allowed to use, they are permitted or they are allowed to use the drugs or specify the drugs in cases wherein it is very complicated, and in order to prevent the maternal death or mortality, the auxiliary nurse midwives, LHVs, and SNs are permitted to use the drugs. Now we move on to the emergency obstetric care. The emergency obstetric care, the first referral units have to be made operational for providing the emergency obstetric care. If the case cannot be dealt at the primary health center, we refer it to the first referral unit. So operationalization of the first referral units is very important to provide the emergency obstetric care. The minimum services which are provided by the fully functional first referral units are so on. 24 hours delivery service, including the normal as well as the assisted delivery. They need to provide, the first referral unit has to provide the service for the normal delivery as well as the assisted deliveries. Emergency obstetric care is including the surgical intervention, including the cesarean section has to be performed. Newborn care, emergency care of sick children, the RCH phase 2. What are the interventions it is including? The main initiatives which were planned, first was providing the essential obstetric care. Now we are discussing about the emergency obstetric care. In emergency obstetric care, we are strengthening the referral unit. The referral unit has to provide 24 hours delivery service. It has to provide the essential obstetric care, treatment of the newborn sick children, emergency care of sick children, newborn care, full range of family planning services, including the laparoscopic sterilization services. They have to provide a full range of family planning services, including the laparoscopic. So we see on a higher level, laparoscopic services has to be provided by the first referral units. Safe abortion services, the medical termination of the pregnancy, wherein the safe abortion, we are terminating the pregnancy. These services are also provided at the first referral units. Treatment of reproductive tract infections and STIs. So we saw in RCH phase 1 the special clinics at the district hospitals for the treatment of RTIs and STIs. Blood storage facility, so that any emergency of blood transfusion arises, the blood storage has to be there. The blood storage facility, essential lab services, and also the referral, that is the transport service. If the pregnant mother has to be referred to the other medical hospitals and colleges, she has to be sent to the urban hospitals, private sectors. Then if such a situation or a condition arises, the referral transport services should be made available. Clear, guys? These are the things under the emergency obstetric care. Then comes the strengthening of the referral system. So the funds were given to the panchayats to provide the assistance to the poor people in case of obstetric emergencies. The panchayats were given the funds so that they can provide the assistance to poor people in cases of obstetric emergencies, and involvement of the local self-help groups and national non-governmental organizations and women groups. By how can we strengthen the referral systems? By involving the NGOs, taking help from the women groups, by involving the local self-help groups. Okay, based on this, we are trying to strengthen our referral systems. Okay, moving on to the new initiatives under the RCH phase 2. Training of MBBS doctors in life-saving anesthetic skills for emergency obstetric care. We are training the MBBS doctors. They are trained in life-saving anesthetic skills. In cases of emergency obstetric care, we are teaching them the anesthetic skills in life-saving emergency obstetric care. The government of India is also introducing the training of the MBBS doctors of obstetric management skills, prepared training plan is given for 16 weeks in all the obstetric management skills, including the cesarean section operation. So we see the GOI, that is Government of India, has introduced the training sessions for the MBBS doctors in managing the obstetrics cases in all the. So the training is done for a period of 16 weeks. They are providing the obstetric management skills, and they are teaching them, including the cesarean section operation is taught. Setting up the blood storage centers at the first referral units according to the Government of India guidelines. We are also setting up the blood storage centers according to the GOI guidelines. We will set up the blood storage centers, so if there is a need of blood transfusion, we should have the facility at the first referral unit. So this is about the RCH phase 2. With this, we come to an end of the video. If you like the session, hit the like button and subscribe.